you can all see this cartoon or tune, whatever it is. It's about oratory skills or whatever you want to talk about. But in fact, this is it. Oral presentation skills rather. If your skills are not good, you will kill the people who are listening to you. So oral presentation skills is about not killing the people who are listening and looking at you. Okay. But the issue is it's not just about you, the person in the current time who is speaking or who is trying to teach, who is trying to put across their ideas or whatever it is. It's about people who listen to you also, who look at you, who look at whatever you are presenting on the audio visuals, etc. So when we talk about presentation skills, be it be oral or whatever it is, there are usually two major players in this. One is the one who is talking, who is presenting. The other one is the one who is listening and who is seeing. But there is something that connects these two, that is the media. That is the so-called technology or techniques that we use. So when we talk about presentation skills, you have three things that you really have to get hold on. Yourself, the speaker, your audience who is going to listen to you, and the media that you use to put your thoughts and things across to the listeners. You just saw what happened to Pankaj. Fantastic speaker, handsome to look at. The listeners are all masked in their own online activity. But what happened? The media gave him hath. So this is pretty important. That's how we need to start our activity. Let me talk briefly. I will just give you a concept. We had a discussion there for yesterday that this particular module of presentation skills is a really big one. It is not going to stop at oral presentation, poster presentation, this, that, and all that. So probably we would like your assistance and help to stretch it for at least another 2 or 3 activities, another 2 or 3 modules, so that everyone listening, especially the young ones who have logged in or who have been online now, would get the best out of how to do the presentations, right? Now, what are the types? Extempore, impromptu, manuscript, and memorized. You have 4 types of presentations. Extempore, you all remember in your high school and probably in college, first grade colleges and all that, they would give you a chit rather, some word or a phrase or a small 3-line or 2-line concept would be written. You will be given about 5 minutes to prepare, come and speak. That's extempore. Impromptu, you have to talk immediately. Whatever that is asked you, you have to talk immediately. Manuscript, you all know, you prepare. You remember in olden days, about 10-20 years ago, it was very popular for politicians and important people to hold some cards, some 10 or 20 cards, and go on looking at them and talk. Manuscript descriptions. Many times we still do it with some notes kept on your side when you are presenting your audiovisual activity. And the last one is memorized, which most of us do. We memorize whatever that we do. So there are 4 types of presentations you do: extempore, impromptu, manuscript, and memorized. But today, what really offsets or puts us on a different pedestal is it is medical presentations. Presentations that are important in medicine as a teaching tool or as an understanding tool, right? So you have to have extempore, impromptu, manuscript, and memorize all put together. This is one place where all the 4 common types of presentations come under one umbrella, or they, confluence of 4 presentations. But if you go a little bit deeper, or when you have been a speaker for quite some time and you have been an audience in many of the, CME programs or whatever it is, there are 4 more types that is very important. Informative presentation, that is reporting, briefing, and your research. It should have been reporting and briefing research. I'm getting older, I put a comma there. Persuasive presentations, policy making and value judgment. You all know when it comes to a new drug, You need to have a persuasive presentations to convince the persons who are sitting in front of you whether this new drug really works, this new test really works, etc. like that. And demonstrative presentations where you give instructions and training sessions. You all know about it. And the last one is inspirational presentations. These are the 4 types. But let me reiterate again, when it comes to the field of medicine, it's not only extempore, impromptu, manuscript and memorized, it's also informative, persuasive, demonstrative. When you put all these things together and you become an accomplished speaker or a presenter, it becomes inspirational presentation. So at the end of these 3 or 4 modules, I fervently hope and request all of you to have inspirational presentations. That means the day you present, whether it is poster, oral, or whatever, you should inspire the audience to such an extent that they shall remember you and they shall do the best for the patient population they want to go. Okay? This is in brief about types. Now, barriers to effective presentation. This is something you really have to work on. Otherwise, as you know, you may be very competent surgeon, very competent physician, very competent this, very competent that. But when it comes to effectively present your ideas or your research and all that, unless you overcome these barriers, it will not be inspirational. It will not be demonstrative. It will not be very, very effective presentation. The first one that we really have to go out of is the fear, conquering the stage fear. Standing in front of a population, be it 5 people, 10 people, 100, 5,000, conquering the stage fear. You remember, in majority of these so-called popular stage presentations, they put very bright lights in front of the presenter. This is one way of conquering your stage fright because you cannot see your audience. The bright light is looking at you. And when you look in front, it looks empty. This is one of the ways you can conquer your fear. The second one is body language. This I will be very happy to give you another concept of body language, probably some next modules or whatever it is. But more important is to unable to control the flow of thoughts. Unable to control the flow of thoughts. This is one of the biggest barriers for your presentation. Why? You are given 8 minutes for a paper presentation, 20, 15 minutes or 30 minutes for an oral presentation, etc. Unless you control the flow of thoughts, you will not be effectively presenting what you want to tell your audience. And lack of preparation. What is this lack of preparation? Oh, I have been in practice in diabetes, in the field of diabetes for 35 years. What can, you know the story? What can they think about me? I know so much and all that. No. Whether you are a 30-year of experienced doctor or a teacher, or just a newcomer to teaching and all that, preparation is one of the most important concepts that you should work on. Otherwise, it's a major barrier. Simple concept is some fright is very helpful. If you are a little bit very scared that you are going to present to your peers, it's very important because you have an adrenaline drive. Can you remember when there is some amount of extra adrenaline that comes in your system, not that you have a little bit more of heart rate, etc. like that, it sharpens your mind. That helps to control the flow of thoughts. That unless you have prepared itself like that, this amount of fright will become large, a larger concept or larger quantum of fright, which will lead to chaos, So if you ask me, you need to really be a little bit scared of presenting effectively to your peers. Have an energy for glucose for the brain. I was just for the sake, because I've seen many people, they finish their practice, their everything and all that, they run to the so-called CME, empty stomach, empty, how do I say, circulating glucose, etc. like that, and an empty brain. It is always necessary. What I have been doing, just before the presentation, I'm sure some of you have seen, I'll have a cup of coffee. And though I don't take sugar these days, I ask them to put some amount of sugar into it, table sugar, and drink it. It definitely helps. Let me tell you this. and positive thinking. Be positive. Definitely, you know so much of information. And unless you think, oh, how can I put this? I may lose these thoughts. I may not get the right words, etc. No, have positive thinking. Be very simple in your approach. Use very simple words. Have some little bit of fright, little bit of scare, that so there is some amount of adrenaline drive that sharpens your mind. Control your flow of thoughts. But above all, please prepare. Let it be the same thing you have spoken 2 years ago. Prepare again and again and again. So practice, practice, practice. Where do you practice? I've already told in other places, and many of you may all know about it. The best place to practice in front of a full-length mirror. You understand? Practice in front of a full-length mirror. You know your body language. You know how your face moves when you pronounce certain words. And it will give you positive thinking that I can do it. I will do it. Okay? Now, I'll just summarize the whole thing into 4 P's. Just 4 P that you should remember. The 4 P are planning, preparation, practice, and perform. So these 3 P is before you start effectively presenting. The 4 P is about performing. These 4, if you can put perspectives into it, how to plan for it, how to prepare for it, how to practice and perform, down the road after 1, 2, 3, 4, or 10 or 15 presentations, it becomes a spinal cord reflex. You don't have to use your cortical cells for all these things. Put yourself in that right direction of planning, preparing, and practicing. Performance becomes pretty easy down the road. Okay? First concept. Now, do you know this word? It is picha kucha. When you see it, could be pika kuka. Okay? This is the punny language of English. It could be picha kucha. It is pika kuka. If you are a Japanese, it is pika kuka. And if you are an European, it is picha kucha. Whatever it is. Anybody who can remember what this word is about? I'm sure many of you are Googling into your, Googling through your mobiles. Let me save you time. It's a Japanese word meaning sound of a conversation or a chit chat. Pika kuka is the sound of conversation or chit chat. The sound, it's not even the letters, not even the substance. It's the sound of conversation or chit chat, which is very, very, very important in a presentation. Everybody can prepare best of the slides, best of the texts and all that. It is the sound that makes a great difference. Otherwise, in all CMAs, all you have to do is, ladies and gentlemen, I'm going to show you beautiful slides or beautiful texts. Please read. I'll keep silent. Has it occurred to you any time? Have you done this in your lifetime? No. It is the sound that makes your presentation much more likable, much more lovable. It's simple concept of pika kuka, but originally in Japanese, it involves changing slides every 20 seconds. There can be a maximum of 20 slides, which means the presentation lasts only for 6 minutes to 40 seconds. That's all. Maximum 10 minutes, they will be able to listen to you. Beyond that, everybody will start drifting away from your speech. So this is a fantastic concept that the Japanese have brought in. And this is what exactly is expected in oral presentations. You remember, as postgraduates, many of us, we presented, they said not more than 8 minutes. Out of that 6-minute presentation, 1 or 2 minutes, question and answer. But some of them would go on and on for 15 minutes. You remember? So it is time you get the concept of pika kuka in your mind and start presenting with 20 seconds. I usually say if you have one slide, at least 30-40 seconds, you can make greater sense. So if you have 10 slides, it's about 40 seconds into 10, you do the mathematics. I'll just leave it at this. The PPT mostly has graphics and very few words, so that the sound from you is more important than the words, right? And this type of presentation is best suited for, I've already told you, oral presentation, especially paper presentation, especially podium presentation for 10 minutes. Lastly, the multimedia, the one between the speaker and the listener. What is it? The multimedia, which takes your sound, which takes your body language across to the listeners. You remember the concept of VARK? Walk stands for the way we learn. Learning abilities from a young age till you come into higher education is broken or not broken. It is mainly concentrated as VARK. V stands for visual, A stands for auditory, R for and K for. VA is very important. R is
K is kinesthetic.
No, I know. Kinesthetic and R is not necessary in this. VA is very important because there are some people who are visual in their learning, A who are auditory in learning. So when you put a slide which has graphics or pictures and a little bit of words, and when you speak them out, the VA part of it, they become very, very, very happy and very, very comfortable with your presentation. The K part of it, kinesthetics, is not here. It is not necessary for a higher education learning like, postgraduates and others. I just wanted to tell you because it is the multimedia which helps you to effectively put VA learning process across to your audience. Okay? So last leg of my speech will be posters. An effective way of presenting your research. Yesterday we were talking. Dr. Neeta told me, are we talking about only research or anything else? So I thought, let me wall off to just research and put this slide on. Scientific poster presentation, the template, there is a title. There is another 1 or 2 lines which tells about author names and information and the list of sequence of authors, etc., etc. You all know the story. And this is how you have to spread. Unfortunately, can you imagine now the posters that you have seen? It is cluttered. They start with something, somewhere else they go, something else happens. Okay. So in simple concept, when you present a research, it should be introduction, methods, results, and conclusion. I told you it should be graphics, and a little bit less of words. You need to explain this, okay? And of course, this I just mentioned, where you are presenting. Most of the times I see in the poster, they would not have put KRSSTA 2022. Just a poster there, and you don't know where this poster goes next. And sponsorship details, sometimes research expects who has sponsored your research, if it's a clinical research or whatever it is. And of course, you can put this is the person who has done life sciences. You can put your institution logo if you want to. Some people put it here. It doesn't matter. You can put the logo here. You need to tell about the details where you are presenting this, and if at all there is a sponsorship. It's simple. In a nutshell, it should look nice. Do you think it looks nice? Yes or no?
Yes, sir.
Right.
Too overcrowded.
Excuse me?
Overcrowded.
Overcrowded. Okay. Any answers for this? Okay, let me tell you, when you look yourself in a 65-inch TV, do you think you are larger than life? When you look in yourself in your 11-inch, laptop, do you think you are smaller than life size? This is where it happens, When you put your poster, this poster will be how much? We'll talk about it. I'm sure the coming speakers will tell you about what should be the breadth and length and all that. When you put this in the larger perspective of a poster, it does not look overcrowded. It looks okay. Why? You are not going to increase the font size. You are not going to increase the size of the picture. It remains the same. You can imagine it gets blown up. It gets blown up into a larger 3 feet by 5 feet or 2.5 feet by 4 feet or whatever it is. It does not look overcrowded. Okay. Now, the last thing is do's and don'ts. I'll just go through it. The title, I already told you, use short titles. I have seen when I have been requested or asked or commanded that I should be evaluator or be a judge for these poster presentations, the title runs into 4 or 5 lines. Please don't do that mistake. Let it be very, very simple. It doesn't matter what you want to tell, you tell it in 4 or 5 words. That is fantastic. Then you can explain the expansion. You remember research question? It should be one single line. Hypothesis should be 3, 4 or one medium-sized, how do I say, paragraph. You remember that? Research versus hypothesis. So when you put a title, let it be catchy and as little words as possible instead of using 25 words and confusing the examiner, evaluator, or people who want to look at it. Okay, and author credentials, you have to be a little bit careful of how you put it. References and acknowledgement. Some people say you can put it at the end of your presentation. I leave it to you. Don't leave people to wonder about who did the work or omit references. Okay, it's very, very important. Poster space, I was telling you about this. This is very important on the stand size. So beforehand, when you apply, when you send your poster, please request the scientific committee coordinator, scientific committee member, sir, madam, please let me know the stand size. They tell you your poster size is 2.5 feet by 4 feet, the stand is very small. After 2 or 3 of your presentation, the 4th fellow comes, your poster is already sleeping. So please find out the stand size and request them if it's 2.5 this thing, it should be the stand. I'm not going here. I'll just tell you about the thing. One large poster. I showed you. This is one large poster, which has a single spread or individual columns. Can you see? Individual columns, 3 or 4 columns. You divide it into whatever you want to talk about it, or individual pages. This, don't worry, this is used for one-on-one teaching. 12 pages, one less than A4 size, 12 pages you put and all that. One-on-one, you sit across a table and you can talk, or 3 or 4 people listening to you do that. But for us, one large poster and with individual columns is sufficient and absolutely good. Software options, invariably the softwares that we use are PowerPoint. That's all we use, whether it is a poster presentation or whatever it is. But advanced Adobe Illustrator, Corel, InDesign have more features and can put your graphics in better perspective than PowerPoint. But don't try to overachieve by using unfamiliar softwares. If you're not used to InDesign or Adobe Illustrator, don't request an expert to do it and then get stuck when you're presenting. Okay? Placement. Place your poster such that the average viewer will have about 60% of the poster above the eye level and 40 below, because looking up is easier than looking down. I have seen, I'm taller, there are some shorter people. So you see to it that the poster placement is in such a way that more than 50% of the poster is above the eye level. If you are 5 feet 4 inches, it should be at least 50% should be above 5 feet 4 inches. Otherwise, looking down will be very difficult, or looking up significantly is also hurtful for the people who are going to look at. Okay? And the content, decide on the poster content beforehand. I told you. Think of it, practice and start doing it. Why the research question is important. Instead of putting 3 lines of research, think why research question is important. What strategy is used? What are the results? What are the results that are unique to your research? How does this relate to other research, and what comes next? This should be spoken in your poster. You just put your results. We screened 466 people, 300 were females, 266 males, and all that is very, very tasteless presentation. It's all right. They can see that and all that. But look at what are the results you have, important results. How is it unique when it compared to other researches? And what comes next out of that? It's very important. Okay? The same thing, don't try, use too much text, don't too many illustrations, don't put too much details. You know the story. I am not going to bore you about that. That's it. Thank you.